Maryann Lombardi, and I am the Associate Director for the Creative Affairs Office here in Washington, D.C. Welcome to the Care for Creatives Community Conversation Series on mental health. Care for Creatives is a partnership between the D.C. Creative Affairs Office and the George Washington University, which provides pay-what-you-can mental health support to any creative and entrepreneur in the D.C. area who needs it. You can find out more information about Care for Creatives and how to receive care on our website at creativeaffairsdc.com. In today's conversation, we will be talking about mental health equity with licensed clinical social worker Julian Harris. Through his practice, Julian uses a variety of therapeutic approaches in working with clients and offers support through individualized therapy and support groups for parents and caregivers. He also offers training for clinicians and organizations in race equity, building gender-affirming workplaces, and transgender equity and inclusion. Welcome, Julian, and thank you so much for being here.
Thank you, Maryann.
So I'm so excited. Let's just jump right in. And I was wondering if you could help us understand exactly what equity is and how that translates into what mental health equity is.
All right, thank you. Yeah, equity is a word we're hearing a lot more of these days than we used to. And it's a little different from what we used to use, which was equality. Equity is more of how we match resources based upon the needs of a particular person or demographic, right? As opposed to equality, which is about dividing resources in the same amounts. So equity is all about creating a fair outcome for everyone involved, because we know some people have more needs than others. So that's what we talk about when we mention equity.
So when we think about that from a mental health perspective or a health perspective in general, how does that show up, right? Like how is equity sort of visualized, sort of like what happens there?
Mm-hmm. Good question. What I would start with thinking about social determinants for mental health, and there are many. If we think back psychosocially, we can think about how the prenatal and the early years of childhood really determine mental health outcomes. But as far as socially goes, there are adverse early life experiences, poor education, unemployment, underemployment, those types of things, including poverty, inequality, racism, all these things kind of call for a need for equity in mental health, because those social determinants kind of indicate that a person would be more likely to need mental health support because of all the things that they're facing. However, we know that because of a number of factors that mental health services can be, there can be barriers to people accessing them. And so that's one of the reasons why it's so important. The partnership that you have with the GW that allows people, creatives and people who are entrepreneurs and artists who may not have healthcare or insurance can get those services.
Yeah, so can you talk a little bit more about what those barriers might be, sort of like what the physical barriers or financial accessibility, maybe even barriers on the side of the actual clinician, right? Like the equity on the side of the clinician, right? Them understanding how to treat the individuals that they're working with. Can you expand a little bit more on what those access issues are?
Absolutely. Back to kind of like unemployment, underemployment, one of the barriers is the cost. We know that treatment services can vary in price. Some of them are free and others cost quite a bit of money. So in our region, we know that mental health services can be expensive. Another barrier is whether or not a clinician accepts insurance, or if they don't. That can also include, those can also be barriers. A huge barrier as well, if you do happen to have the time and the money, to seek mental health services is you might not have PTO, or you might not have childcare in order to take the time to go and see someone. Um, there are stigma, right? There's still a stigma, a huge stigma in many communities around seeking mental health services. And, that's a huge barrier, feeling as if there is something inherently weak or wrong for seeking services. You asked about barriers with providers. There are many. In order to become a counselor, a therapist, or social worker, you have to go to graduate school. And we know that graduate school requires, in order to go to graduate school, you have to have a certain measure of privilege, whether that is being able to afford it, or even having the luxury of working part-time or not working at all to pursue your education. And not many people from marginalized communities have that opportunity or that privilege. So sometimes people will find that they cannot find therapists that look like them, that come from communities that they are a part of. Many Black, Indigenous, people of color, LGBTQ plus communities sometimes find that the field is dominated by whites and heterosexuals. And whether or not the clinician is judging, because that's our role, is to not judge. There can feel like there's a sense of judgment over you, but there is a lack of understanding. So sometimes people are reluctant to seek services because there aren't folks in the profession that kind of mirror themselves, and they feel disconnected.
So if an individual is seeking care, how do they get past those barriers, or how do they confront those barriers, or how do they navigate those with a potential therapist?
Mm-hmm. Well, there's a number of ways, but I think the most important thing is to remember to be patient, because it takes a long time to find that a good match. Sometimes we're lucky enough where we can find someone and you just hit it off, and that becomes your therapist, and you have a wonderful relationship and a lot of growth and connection. And other times there are misses. Thinking of an analogy of dating, right? You meet someone, they look good, they sound good, and you sit down and you start to have a conversation, and you realize that you're on a different wavelength and there's not much in common. So it's similar to that. You don't just quit dating, you date someone else until you find a better match. And so when it comes down to finding a therapist, it's very important that you feel heard. That the therapist isn't just making assumptions about you, but listening and able to reflect back what you're telling them, and helping you from an individualized perspective, not just one size fits all. Someone who's willing to challenge themselves, and someone who's willing to answer questions about. Mm-hmm.
So that brings me to thinking about, so from the clinician's point of view, how do they overcome, maybe they can discover that they may have, some barriers of their own, or some lack of understanding or education. Are there ways that they can expand their knowledge to be more open and welcoming to folks of color, or folks within the LGBTQ spectrum, or folks who don't look or experience what they have?
Absolutely. And as a therapist, I'm someone who believes that people grow and can change. All it takes is a willingness to do so. So, in my opinion, I think it's really important for us all, as helping professionals, to check our own biases. There are implicit biases that we all kind of have within ourselves. And so when you are charged with helping someone who is coming to you in a vulnerable position, it's important to check and make sure that you're being as accepting and open as possible. The second thing is to get training. There's tons of trainings all the time, and mental health professionals, we have to every year we have to renew our continuing education units and credits, and we can use those pretty much any way we like. So if you'd like to get more training around gender identity and sexual orientation, if you'd like to get more training around BIPOC communities and working with marginalized folks, those trainings are available. So there's lots of different ways in which people can educate themselves in order to be the best provider that they can.
How do you check your bias?
Yes. There's a number of different ways, there's, I think of it in terms of, one of the activities that I engage in is at the end of my workday, I try to reflect on the individuals that I worked with to see if there's anything that, from the discussions that we've had, if there's anything else I want to revisit. And sometimes during those reflective moments, there are times when you can question, like, was there any bias on my part? Just a little self-reflection. Harvard had this really great study. This has a really great tool around implicit bias, and it allows you to take these tests that test your bias around race, but also weight, also religion, all different types of ways in which we can kind of have preconceived judgments around others. And I think that, the biggest way to change, as Carl Rogers says, he says, the curious paradox is that when you accept yourself exactly who you are, that's when you can change. So if I can acknowledge and accept that there may be bias, that's when I can change it.
Yeah, that's great information. As a client, like somebody who may be seeking a therapist, what are some of the questions that they could ask their therapist when they're dating? And maybe that's the wrong thing. Maybe we don't want to say date your therapist, because I can imagine that's not a good thing to do. But as you were looking for a therapist, are there different kinds of questions that they could ask that could help them figure out whether it's a right fit or not?
Absolutely. And one thing that I have done and I encourage people to do is to ask your therapist if they've worked with people like you in your community. You can, to find out what their level of comfort, what their level of competence is in those particular groups and demographics. And if they say no, what's their willingness to be open to learning? It's important to also ask what their kind of modalities are that they use. Some people use CBT, some people use mindfulness, some people are person-centered therapists, and there's, different kinds of modalities work well with different people. So those are some of the main two most important questions I would ask. I would also, you want to make sure that they're available. Are they going to be available to meet weekly, or is their schedule more sporadic? Are they available to meet? Right now everyone's telehealth, but there's just those types of kind of logistical questions as well. So those are some of the questions that you can ask when you first are introduced to a new therapist.
Yeah. So from the perspective of modality, what does that mean? Like, if you don't know what CBT or person-centered might be, how would you know that one might be better than the other? Are there ways to learn a little bit more about that so you understand when you're asking that question?
Yeah, I think so. Especially like in the assessment phase when you're with your therapist and you start to talk more about what your goals are. It's important to ask, how can you help me work through my issues of depression or generalized anxiety. And from that conversation, you can kind of glean what that modality is. And you can just ask, what kind of treatments do you think work best with someone with my particular diagnosis? And you can ask what their success rate is. I think the most important thing is the most important thing is that they're using an evidence-based practice, but the thing that determines the success is the relationship. The relationship between the client and the therapist is the number one determinant of healing.
Yeah, you know, it's interesting. It makes me wonder about like how at the beginning it must feel important to find somebody who, if you're a member of the LGBTQ community, finding somebody who may be within that same community with you, that might seem to be the most important thing. But what you're saying is, yes, that can be valuable, but what's more valuable is the relationship that you build with that person, whether they are a part of your community or not. Is that correct in that thinking?
That is correct. I mean, you're just not always going to be able to find someone who is in your community, and even if you do, this does not, mean that they're going to be the best fit for you. I think for some, it is important. You're not going to find a ton of trans therapists. There's a handful of us. You may find more plentiful LGB therapists, and you may find, it's also finding Black therapists especially Black masculine therapists can be difficult. And so I don't want people to feel that if they are Black and trans, if they don't find another Black and trans therapist, that they won't have a favorable outcome from therapy. They can, very, very much so. It's having that option can be also very healing as well.
Mm. So can you talk a little bit about trust? The value of trust, how you build trust within, a therapist-client relationship.
Mm-hmm. Yeah.
And I'm curious what the role power has to do with it too, because there potentially seems that there could be a power dynamic that exists as well.
Mm-hmm. Yeah. There is research that, hanging up your degrees in the therapy room can make it more difficult for the client to feel at ease. There are power dynamics. However, once you are, the thing about therapy is it's a collaborative endeavor. And so there isn't one person that has more control. As far the therapist doesn't have more control than the client. And so that's the important thing to remember. We may have the training, but we don't control the choices that our clients make, and we don't tell them what to do. But I think that sometimes there can be dynamics that feel kind of like parental kind of roles that kind of play out in the therapy room. The other thing you asked me was about trust, and so that's very important too. So one of the things that before you really can get into any deep kind of treatment, you have to build rapport. Your client has to know that you're safe, that you're going to be there when you say you're going to be there, that if we have an 11 a.m. appointment, that I'm there and I'm ready to work, that the things they say, I have a neutral attitude about. I'm not giving you any sense of my personal kind of feelings or judgments about you. And those ways, listening, hearing them, all of those things build rapport and build trust. And over time, they'll start to see you as an ally, as someone who is collaborating with them on their care and not as an authority figure.
Mm. When you mentioned stigma early on, where does that stigma come from, and how do we approach that, right? How do we approach breaking down some of that stigma in order to provide more support for folks?
Yeah, yes, stigma is huge in mental health, but it's something that's changing as well. People's attitudes around seeking mental health support has gotten more favorable, but I know that there are still many people who correlate seeking help with being very ill. And there's nothing wrong with being very ill, but the point is that you don't have to be. A lot of the work that we do is preventive, and so you are experiencing symptoms of discomfort, of anxiety, and so getting treatment at that point before things get worse is a preventive measure. Um, Stigma, it's stigmatized in every, I would say, in every racial demographic, and every group. Um, but I think that especially prior to the 2010s, mental illness was kind of made fun of a lot in popular media and movies and television and that type of thing. Um, and so I think that played a major role on uh, people's reluctance to seek services or even tell their friends and family that they're in treatment.
And does that feel like that has changed over time, and that there is a
We're getting there. We're getting there. We're not all the way there. There are still people that I see who aren't comfortable letting their people in their life know about themselves being in therapy.
Are there that makes me wonder whether or not there are small things that each of us could do that helps break down that stigma a little bit, even if it is just being willing to say, yes, I have sought support before, and this is how it has helped me. And, just being a bit more open about those things within our communities, or even just our families.
Yeah, I think normalizing it is the way to go. Also, I think the important thing to know is that more than likely your therapist is in therapy or has been to therapy. I mean, I believe every therapist should, at some point in their life, receive therapeutic services. I know I do, and I love it. It keeps me in a position to be able to help other people, I think. You can't pour from an empty cup, and you have to make sure that you're in a healthy space in order to help others. So I'm very open about the fact that I have a therapist, and that I think it's one of the things that helped me when I started going when I was a teenager. I look at it as a preventive measure, like going to the dentist or getting your annual physical with a doctor. Just kind of checking up on yourself before, it's like getting the tune up to make sure nothing's wrong with your car. But yeah, just normalizing it. I think being open about it, defending it when others are kind of are being, disparaging of it. Those are ways in which I think we can all support others and help reduce the stigma around mental health.
Are there other ways that that all of us, whether folks are in therapy or not therapy, can help break down some of those barriers? Getting back to the equity part of it, and I know there's multiple barriers, but what can the everyday person do to either advocate for their own access, but also be more open to advocating for a broader access for everybody?
Mm-hmm. That's a great question. You're right, and I think that as social workers, it is, as a social worker, it's my job to not only work in the micro sense, but also in the macro sense of really lobbying for lawmakers to make mental health care, make access to mental health care easier and more accessible for people who don't have a lot of means. It's important for us to, uh, there are some organizations right now who have created funds for people who don't have a lot of them to be able to access therapeutic services. And so I think that a on an individual level, one of the things we can do is we can really kind of try to persuade our lawmakers, legislators to really kind of make mental health care as widely available as medical care is, because that's the only way. I mean, right now people have equal access, but it's not equitable in the sense that it's still not accessible to everyone who needs it, right?
What's been the role of the telehealth right now, right? It seems to have opened up an enormous amount of opportunity for some, even though it sounds like there's all sorts of licensing challenges about people getting care. But it's interesting. Has that had a broader impact on the access issues?
Yeah, it has made it much more accessible for individuals to come to therapy. Um, I've had colleagues tell me that it's really dropped the no-show rate quite a bit because people don't have to leave. People didn't have transportation before, or people couldn't take time from work before, and now that they're working from home, or their schedules are more flexible, they're able to have more time for therapy. So it has increased accessibility and it has made it a little more equitable. Um, Other good things are people can be traveling. They can be away from home. I've worked with folks who just parked their car because they were like they didn't make it home in time, but they wanted to get to sessions, so they just parked it a lot, and then we did it virtually over their phone. That's been one really good success of the telehealth, um, teletherapy. Some of there's drawbacks as well. People may not have access to high speed internet, so there's connectivity problems. There's it's hard on the eyes. It can be. um, there's a little loss. There's a little bit lost as far as body language, being able to track, read body language. All for the most part, we can only see from the chest up. We don't know what people are doing with their hands or their feet, or so there's some things they're missing, but the important, eventually one of these days we'll be able to meet back in person again. But I'm grateful that we've got telehealth, and I think I will continue to use it for folks who don't have the luxury of coming down to my office to meet once a week.
Mm. Just to close ourselves out here, I'm curious. It sounds like there's a role for ourselves to be our own advocates, right? Like that we really do need to be our own advocates for not only our access to mental health, but also to our own care. And so I'm curious if you have any thoughts or an advice for folks who are struggling right now, and they really do need some help, ways that they can just start,
Mhm.
right? Like things that they could do to just get started.
Yeah. Well, there's some things that people can do to get started, and what I would recommend if you haven't been able to find someone to work with yet, and you're still in the process, is you can start with mindfulness. And mindfulness is just being able to take some time out in the moment, being present, um, without worrying about the future or kind of regretting things from the past. It's just being in this moment, um, understanding and recognizing your safety, and that you are in control right now in this space. There's lots of resources online. There's lots of free resources online, where you can um, find meditations, mindfulness meditations, uh, and things of that nature. There are also some online resources for some thought stopping, for intrusive thoughts that are negative, and causing you to have periods of sadness. There's different things like that. There's Headspace and the Calm app are also good. And I know they have some free trials. And those apps are really great at helping you have a moment to yourself to kind of find that calmness, um, or that peace that you might need from the pandemic that's going on right now. So starting there, but I would also say don't be discouraged by therapists not be having availability or seeing that their costs are high. Lots of therapists offer sliding fee scales, and some of them offer pro bono services for clients that are in need. Some of them have access to um, funds to support their work. This program that you all are offering sounds amazing. So if I would just say my advice is if the search seems really difficult, don't give up, ask for help, talk to your friend because they might know of someone who might have the answers for you as far as finding a therapist to link with.
Are there specialty therapists at all? Are there therapists that may focus on a specific either population or issue or anything like that provides extra resources, say through your insurance or anything like that?
Well, there are times when if you find a therapist that can work with you for a particular issue, then you can't find another one, and they're not plentiful. Sometimes your insurance company will reimburse 100%. I've had a client do that before, reimburse at 100%, so the cost that you pay up front comes right back to you, because there may be a niche that only this therapist in your area can provide. So, always check with your insurance companies. They'll always say no first, but try again. Check and see if if something can be done, because the therapist that you find is going to be the most helpful for you is out of network.
That's so great. Thank you so much for all of this information. This has really been very helpful. And I want to thank all of you who tuned in for this Care for Creatives conversation series. Again, you can find more information about Care for Creatives on our website, which is creativeaffairsdc.com. And thank you, Julian, so much for your time. And everyone else, we will see you again soon.
Thank you, Maryann.
Thank you.